Good afternoon, Dr. Larson. Thank you so much for joining us. We look forward to hearing an update from you, and folks are already putting their questions in the chat box. So thank you so much for taking time for us again. I know you're very busy and we just really appreciate you.
Sure, happy to be here. So, so the nice thing is our numbers are going down. Our incident rate peaked back December 24th. It was 648 cases per 100,000 for 14 days. Obviously a reflection of Thanksgiving. And we hovered in the low 600s until January 1st, and we've kind of been heading downward since then. If you just go back to the 13th of January and then you go back 14 days, we're down to 419. So we're heading the right direction. We're getting about about 10 to 15 cases daily, about 8 cases through the COVID clinic, a few cases through urgent care, and some through the college. The college started today doing their own case and contact investigation. We will still be involved with that and notified of the cases and kind of watching towards how that has, what the interplay is between the college and the county. They are doing a lot more testing on campus currently, including prevalence testing and then obviously testing students who are symptomatic. So that's the positive test situation. We're still way above where we should be from a percent positivity. We're at about 15%. We've been moved into region to what's called the South Central region for moving out of phases, which does affect sports and lots of other things. I see Cole put a question in there. Maybe I'll touch base on that. We have started meeting with the directors and the health officers in the South Central region, which is Yakima, Benton, Franklin, Columbia County, and Walla Walla. We're familiar with those folks, but we haven't worked closely with them, and we are now a very small fish in a big pond. So we're having to push pretty hard to get specific things done for Kittitas County, but we've got our hands in the pot anyway. We would expect the numbers to go up considerably as the agricultural workers move back into Washington State, which they're already moving back into Benton, Franklin, the southern counties especially. So we expect numbers to go back up in March, which will affect us moving out of phase 1, which everyone in the state is in phase 1 currently. There's some legislation to move everybody into phase 2. I don't know how that's gonna go. I will be talking, doing some discussion with the legislation tomorrow, the legislation having to do with regionalizing public health. So that's happening tomorrow, but currently we're in the South Central region. We are doing testing, offering testing for all teachers and students in the county. We have plenty of test kits available, including rapid test kits and rapid antigen test kits, as well as the PCR test kits. So the nurses are busy doing that. It's going to be really important to continue to do as much testing as we can because we want to catch those folks that are asymptomatic before they come into school and then disrupt learning. Two of our school districts, Kittitas and Easton, are starting to look at expanding their folks in classrooms. And I had a discussion with both of those superintendents in regards to, certainly the K through 5, that seems to be totally appropriate, but they still need to keep, the limitation, I think, is going to be the 6-foot physical distancing to get more kids in school. Immunization, there's a lot of questions in here about immunization. We have gotten more vaccine. The governor has stirred the pot. I like the governor, but the governor is certainly micromanaging public health currently, which is, in my opinion, is making things a little more difficult. The governor wants all the vaccine that's currently out there in people's arms by Sunday. We could put 2,000 vaccines in people's arms by Sunday, but it seems to make more sense to continue in a process that is sustainable basically till the end of the pandemic. So we are moving forward. I've already been in contact with the governor's office and the Washington State Hospital Association, as well as the Department of Health. And I have a discussion, phone call with Michelle Roberts, who's the Assistant Secretary of Health, today at 3 o'clock, because we have a process that we can move forward. Starting next week, we will be putting those 2,000 vaccines into people's arms on Tuesday. In Ellensburg at the fairgrounds, we'll be doing 250 vaccinations daily. And up at the Centennial Center in Cle Elum, we'll be doing 250 vaccinations daily for those 4 days, which will use up all of our vaccine. We expect to have more in. Teachers don't fall into phase 1A. They also are not, most of them, older than 65. There is a phase finder for those of us looking to see where we fit in those phases, and it will be we'll be using a web-based scheduler called Sign Up Genius. It'll be online this afternoon for people to sign up. There will be extra vaccine. So each one of the, we have 975 doses of Pfizer vaccine, but we're getting more. They're packaged in packages of 5. We're usually getting 6 vaccines out of every 5, so Pfizer's giving away vaccine. I'll be talking to the school superintendents at 1 today to get me a list, and we already have lists of teachers, but what we're going to be asking is having immediate access to people on Tuesday, Wednesday, Thursday, Friday to be able to say, can you come in now and get vaccine? And those teachers obviously are not in the current phases, but we will have ability to vaccinate some teachers this next week.
So Dr. Larson, this is Ginger. That is really different than what the IMT told me. What the IMT told me was they didn't want any more lists, that they weren't doing that anymore, that they had another process. So this is new news for me.
That's not today. That's not what you heard today, correct?
I have not heard anything that we needed to do that until you just said that right now.
Correct. Yeah. So that's a new thing as of today, and we'll talk about it on the superintendent's meeting. But basically, we have some extra vaccine, and we want to get it into people's arms, and all we really need to know is the names of the teachers that are interested. So we are stepping out of vaccine priority protocol to be able to do that, but we are not wanting to waste any vaccine.
So just a point of clarification on that. Is that just for teachers or is that paraeducators, bus
Yep.
drivers? Who is it
We'll
for?
talk about it at 1, because it's not,
Okay.
we're not going to have enough vaccine. We don't have enough vaccine to vaccinate everyone that needs vaccine. So it's coming, but if you look at where teachers actually are, they're in B2 if they're older than 50, and they are in B4 if they are under 50, and that's just going to take a while to get there. So we have some vaccine available, and we want to get it into people's arms. So we'll talk about that at on the superintendent's meeting. But yeah, but you're correct. From the IMT, the information you had gotten earlier is that we didn't need a list, and we don't really need a list. We just want to know some people that we can call when we have extra vaccine available that can come in. Michelle wrote, Chris Reichdale put out a notice that the timetable has changed for schools. I'm assuming, Michelle, you're talking about for teachers being vaccinated? Is that correct? Is that what you're saying? I can't unmute.
I got access now.
Perfect.
So he posted last night that although the change is not reflected on the current document, that there was a change to protocol that people under 50 who are working in schools could get vaccinated sooner if districts and health districts partnered to set up vaccination protocols for that to happen. So maybe that was either, maybe he's misspeaking, or maybe, I don't know if, but that was what he posted last night.
That's kind of true, like lots of other things in COVID. So Ginger and I have talked about this, and we've talked about it at where school nurses are vaccinating teachers and school staff, which I imagine that Mr. Reichdahl is talking about. Cleelm, Roslyn nurses have talked about that. The Ellensburg nurses have talked about being able to do that. What we need to be able to do that is vaccine, right? So whether that is an option, and that would move. We have a lot of ability to move through the B1, B2, B3, B4 phases, which is what allows Mr. Reichdahl to be able to say that. We have the ability to say, once we get 50% of the people in B1, which is the older than 65, vaccinated, we can move into B2, B3, and B4, but the limiting factor is going to be vaccine. So we're currently getting, the governor wants to have 45,000 people vaccinated daily in the state of Washington. Currently, we're only getting 100,000 vaccines weekly in the state of Washington. So we'll have to see what happens with supply. But once we get supply, I think that's a great idea, is to just say, let's set up a vaccination clinic in the gym at Ellensburg High School, and we'll use staff to get people vaccinated. Yep. So I think we're going to get more information, now that the transfer to a new administration has happened today. We don't really know how much vaccine is available in a stockpile in the United States. All I can tell you that currently in Kittitas County, we have 2,000 doses available next week. Safeway has about 100 doses of vaccine. Community Health of Central Washington has about 100 doses of vaccine. And the hospital has another 500 doses that they're giving second doses out to people that have already gotten first doses. So we will get vaccine, but it's going to be tricky to know how much. So a question about how do we prioritize teachers? If you take away that the teachers that are older than 65, right, which already fall into the anybody over 65 can get vaccinated. Teachers working with folks that are working with children who can't mask, those would be high priority. Teachers that have family members at home that have illnesses, that would be another one. Essentially what we'll be doing is getting a list of teachers, and if I'm working at one of the, well, I'll be working at Upper County because I volunteered to be up there every day next week, but somebody working down here will say, whether it's Rich Elliott or whoever, will say, it looks like we've got an extra 15 doses of Pfizer vaccine, and we'll be calling those folks. Once people in our county have received a dose of vaccine, they are guaranteed a second dose of vaccine. So we're not just using them all up, and those are reserved on the state level. We'll see what happens with that. So Taylor Wilson asked about a Happy Feet daycare. There was some miscommunication, misunderstanding. The current recommendation for quarantine, again, is 14 days is best if we are close contacts with anybody, but so 14 days without a test, or 7 days and a test. The 5 days, I mean, the most optimal is the farther along you go, the better it is. If you test somebody at day 7, it's a better test, but it'd have to be a rapid test. So that's being straightened out at Happy Feet, but they have to have a test to get back into if they want to go back before 14 days. So Amy asked about whether vaccinating teachers. I think teachers should be. I think all teachers should be high priority. Currently, they're in B4, and once we can get out of B2, they would move really high onto my list. And so we would be just saying, okay, well, we've got vaccine, now let's get the vaccination clinic started at Ellensburg High School and get teachers vaccinated. So it all depends on vaccine availability. Cole asked, how's our county compared to our region in terms of moving to phase 2? If we were only as a county, we currently have no intensive care unit beds. So if they were one of the metrics is staffed intensive care unit beds of less than 90%. For the last week, we've had 100% of our intensive care unit beds have been full. So we're a little worse off there. Our incident rate is going down, so we're about the same as the region. Our percent positive is going down. That's about the same as the region. We're currently meeting 2 metrics and close on. We're 91% ICU beds full of COVID patients. That needs to be less than 90. So that's the third metric we would meet. And then we still have to meet the percent positive. The region is 18% and we are 15% in Kittitas County. So I think the issue really is that being regional, it doesn't give us as much flexibility to pivot as we could if we were a county on our own. And so, for example, with the immunization piece, I'm pushing saying we're not getting all of our vaccine in people's arms by Sunday because we want to have a sustainable effort. I'm getting lots and lots of negative pushback from the state in regards to that, but I still think it's the right thing. But reopening is going to be harder. Also on the sports thing, Jeff Hashimoto reached out to me this morning about masking for cross-country competitions. He feels very strongly that that's really not safe to make kids that are exerting at that level to be wearing masks. I have reached out to the staff at DOH who made that recommendation to the WIAA, and I've not heard anything back yet. Oh, there was Jeff. You're welcome. So other questions? Let's go back to what Ginger was asking about lists of teachers. So, and again, this is what we're going to be talking about it on the superintendent's meeting at 1 today. But the vaccine that is that we have to use is the Pfizer. Once we unfreeze the Pfizer vaccine, it has to be used. That's going to be used here at the fairgrounds. So we're going to have a lot more extra Pfizer vaccine doses for Ellensburg, Kittitas, and Thorpe school teachers than we are going to have Moderna vaccine, which we'll be using up in the upper county because it doesn't have to be kept as cold. There's just more extra vaccine. We would expect when we were talking this morning on the IMT, we would expect about 1,060 doses of Pfizer vaccine instead of the 975 that they gave us. So that gives us about 85 people that we will be able to call and vaccinate. So if we don't have a list of, if I don't have it doesn't need to really be this person is more at risk of others. It just needs to be people that I can call and say, are you available to come in the next 30 minutes to get a vaccine? Because we have a vaccine for you. So that'll be daily, Tuesday, Wednesday, Thursday, Friday of this next week. I might have a little bit more information when I talk to Michelle Roberts at 3 o'clock, who's the Assistant Secretary of Health and I call her the vaccine queen. She's that's her job to be responsible for all of that.
Dr. Larson, do you have a guesstimate of when the next round of vaccines would be available for the people in those next phases where any teacher could go in, or educator or bus driver or para could go in and get a vaccine? Would you guesstimate end of February, early March, or is that just not something you can even guesstimate?
Well, the state is putting, they're putting like a month for each one of those phases, which takes it into April, which is why Superintendent Reichdahl was absolutely correct. There's some flexibility in regards to what we can do in our areas. we will be getting vaccine based upon the percentage of people in our community that are in each bucket. So, so for example, the older than 65 age range, I had the numbers in my head, but I've lost them now. But basically, the 100,000 doses of vaccine we're getting on a weekly basis from the federal government is divided amongst the folks that that are in the older than 65 category. And the reason I'm pushing so hard on the governor currently is because what the governor said is, because he was really angry that people weren't getting doses in arms, is that if you don't have the vaccine in arms by the 24th, I'm not giving you any more vaccine. So so I'm running that up the chain actually to say that's not okay as far as we're concerned. And it's not okay, and it's just that I don't know if they're gonna. We'll see, but I think we have lots of reason. I mean, we have a good system in place. We could put 1,000 doses like they did in Walla Walla on Monday. We could put all those vaccine in people's arms, but it would not be done in a coordinated, well done, safe, non-wasting fashion. I mean, the whole reason that we're talking about a list of extra people, because we're doing it logically. If Walla Walla had, you know, they're pulling out Pfizer doses, but they didn't have a backup list for people that, if they had extra doses. And so we will know more about vaccine availability in the next week or so, but they're going to continue to give us vaccine. So we've been getting about 975 doses a week is what we've been getting. We've been getting Pfizer vaccine for the most part because we are one community that has a freezer that can store that vaccine at the temperature it needs to be at, where Okanagan County does not have the ability to store that vaccine, so they are only able to get Moderna vaccine. But I can just say, as soon as we get, if it stalls this next week in regards to the older than 65, then we're moving to the B2, B3, B4. So it's not, as soon as we start getting a slowdown, and that's what we did with the A1s. We started, that's why some of the teachers have already been vaccinated, because we said we're not just going to sit on vaccine, we're going to get it into people's arms. So I think what we're going to see is our current president, as of today at noon, is going to push really hard on the supply chain to get more vaccine produced. So and we'll hope that he's able to do that. I think there's a lot of hope today, actually.
Awesome. Well, if there's no other questions, I see a few questions in there about lists, and since this is the first time I'm hearing that we're even using lists again, I look forward to our time at 1 to get some more guidance from you, Dr. Larson, and how you guys are seeing prioritization. And as soon as I find out more information about that, certainly I'll be communicating back out to folks here in ESD, so that this process is very transparent and people understand what that process is.
So there's a couple other, so Jeff Hashimoto asked, will approval of additional vaccine accelerate our timetable? Yes, the Johnson & Johnson vaccine is the next one on the list. The preliminary data that I've seen looks really good, similar to Pfizer and Moderna. The advantage of that vaccine is it's only a single shot vaccine instead of 2. Jamie Hunter asked if she was called. If they were called, could they call somebody else on the list? And the answer is yes. We just need somebody to show up that wants the vaccine. So it's not, if I called someone and they said, I'm sending this other person in, I'd say, okay, we'll have them here in 5 minutes or 10 minutes or 15 minutes. So, our goal is just to get it to people that need it. And I'm not sure if I talked about this. It appears that I was just on with the emergency management folks. The B117 variant will probably be our primary variant by March. So thinking about the spring, that's probably going to be what's circulating for the most part. The vaccine is working for that particular variant, so that's helpful. It does appear to be more to be more contagious, so we would expect to see more illness, but not more severe illness. The variant that's circulating in South Africa and Brazil, we know less of, and there's a new variant in Los Angeles that they think is probably responsible for the majority of the increase of disease that's happening in Los Angeles. But fortunately, their numbers are starting to go down too. So I think the biggest issue for us as a county really has to do with the regional approach that the governor's taken to moving through the phases. And fortunately, that has not been applied to school districts, but we are starting to discuss with them what the other areas are doing with schools. And it sounds like Jeff wants to ask some sports-specific questions, so other people could leave. That's okay first. That's okay too. And the question about the list, let me talk to Ginger and the other school superintendents about how we're going to do that. But basically, when I gave vaccine at Pacifica, so we gave vaccine at Pacifica long-term care facility now about 2 weeks ago. We had extra vaccine, and we were just calling people that we knew that were wanting vaccines. So we gave it to one school nurse in the Ellensburg School District that hadn't gotten it yet. So she came in. A healthcare provider that's a nurse practitioner came in. Her husband, who would fall now into the older than 65 age range, he came in. We had 2 other teachers from Thorpe that drove in to get it done. We're adjusting the lists and moving as fast as we can through with the people that are willing to give it. We have not seen any significant side effects from either the first dose of the vaccine or the second dose of the vaccine. But as somebody who got the second dose of the vaccine, I felt pretty cruddy the first day after. I mean, I was tired and I hurt everywhere, but the next day I felt totally fine. So that's my N of 1. Where can people older than 55 find the list to sign up? By 3:15 today, we will have Sign Up Genius up and running. So we'll get that. You can go to the public health website, and there'll be a link to there. And at least that's what Tristan is promising me, that's going to be available at 3:15 today. We also have a vaccination specific telephone number. It's 933-8315. Rich Elliott manned that phone yesterday. He took 115 telephone calls. His wife is currently manning that phone today. And most of the calls are coming, most of it is people older than 65 and people that are concerned that they're not very computer literate. What we will probably do with those folks is that we will walk them through the sign up genius with them on the phone. Rather than signing them up themselves. But that phone is available 9 to 5 Monday through Friday. Okay.
Well, thank you.
Jeff, do you want to ask your questions? And you all know how to get a hold of me, so please reach out whenever you have something that you want to ask. Oh, I can't, Jeff, but maybe Ginger can.
Yeah, actually, Matt's kind of doing that for us when we have so many people. It just makes it easier. Let me see if I still am able to do it.
Who do we need unmuted?
Jeff Hashimoto.
Hang on a second, let me find him.
Okay, thank you. Can you hear me okay now?
Yep.
Okay.
We can.
All right. Well, I guess, and I appreciate your advocating. I guess I have two things, and I just want to first make sure I'm not off my rocker. But I am really concerned, and as I was researching, so for other people on the call, my concern is WIA published some guidelines for competition for running, where they said masks needed to be worn by competitors. And I heard from one of the people that their big concern was people running in groups or packs of people. And as I was researching this, I came across a couple articles that talked about additional risks of heavy exertion with masks. And I picture runners, runners really push to their limits during races, and the masks are, depriving them of oxygen and interfering with their ability to expel CO2. And I came across some things that may really concern me about the health risks and even a possible elevated risk of sudden cardiac arrest. So I guess I wanted to know, am I overblowing this, or I'm very concerned about it. That's my first question. Am I off my rocker?
Not in regards to that. I think that's, I think the articles you sent this morning were reasonable. And everything I had seen up till that recommendation from the WIAA allowed for people to have their masks off under extreme exertion, which would be things like cross-country running, cross-country skiing. We have not seen in the states that have been running, there have been states that have been running throughout the whole year. We've not seen any transmission that's related to cross-country ski or cross-country running meets. So,
so that was my second question is, am I correct? And I've been looking into this and trying to figure that out also. So you're confirming that the transmission risk is quite low, or there's no documented mass outbreaks or even transmission in that kind of brief contact.
There has been not documented transmission at a cross-country meet. It's outside. People are not close together. yes, there is, there is aerosolized transmission, but that's not where the transmission is happening. I have a feeling that decision was made more from a legal basis than from a medical basis.
So I guess my follow-up is, how can we advocate to get this changed? Because I feel like I'm in this situation where I'm having this crisis of conscience where I don't feel that I can, like, I don't want to be involved in having any Ellensburg runner put in that situation. So how can we get this? How do we? I mean, one idea is that Cole had the idea of doing a petition of coaches and athletes to the governor, but I'm not sure what ideas you have about this. I'd be really interested.
Yeah, well, I think the first thing that I did was reach out to find out who had made that recommendation to the WIAA from the Department of Health and where the data had come from. So I've not gotten the answer back from the state yet in regards to that. The petition through WIAA would probably be the most efficient way to do that. I've not been, the governor's micromanaging public health, but usually the changes that I'm getting through the governor's office is not from talking to the governor's office themselves. It's talking to the people who push on the governor. So, but currently, and John says the same would hold true for track. If and I agree. I agree with that totally. So I would push on the WIAA and push through the Department of Health. And when I get the name of the person at the Department of Health that made that recommendation, I will pass it on to you.
Okay, that would be great. So we'll work on getting a list of some kind of petition that we can send to both the WIA and the health department. It would be an effective way to go about this.
That's what I would do. I think the governor has his hands full, and he's pretty busy making decisions based upon vaccination. My guess is the decision on masking for cross-country runners was not made at the governor's office.
Well, thanks very much for your advocacy, and I don't want to take too much of your time because I know you're going from one Zoom to the other, but yeah, I really appreciate it. And yeah, it's been challenging for me just thinking about, oh my gosh, if that stays in place, what do I do? And what do I do? Because I don't want to be a part of putting our kids at additional risk. So
I think that's the point. I think that's the issue, is that we don't want to be doing something that's going to be increasing people's risk. And I would ask for the data, which is what I'm going to ask for. Show me the data that says that changes, that having them wear masks lowers their risk of getting COVID and doesn't increase their risk of having something else happen. So,
well, thank you very much.
Oh, you betcha. Yeah, it's nice to do something that's not vaccine related these days.
And I think Wendy had a question about antigen testing for sports, and I replied back to her, I mean, that's our local decision. I think we have plenty of antigen tests. So if we wanted to set up something as far as testing for athletes, I'm assuming that that's something that we could do. And or it sounded like you still at the COVID clinic, would that be where it'd be at if parents of students wanted them to get an antigen test from the health department? Like, let's say that it was on a Saturday and we weren't open and a parent wanted their child to be tested. That's question number one. Question number two is, my understanding is we have plenty of antigen tests, and if we wanted to set up something ourselves around, testing for athletes, or figure out a way that might work for us that that's a local decision and we could do that?
That's a local decision. We have more than enough antigen tests. So one way of looking at safety, and Jeff and John and Cole, this might be a way to do it, is to say, you know, if we're going to have events like this, if we're going to have a cross country meet, we are not going to mandate masking during the event itself, but we are doing rapid antigen testing. You know, you're obviously doing symptomatic testing. Somebody who's got a fever shouldn't be running in a cross country meet, but you've got a bunch of asymptomatic kids. Well, do rapid antigen tests on them before the meet. If somebody's positive, they get pulled out. And so that being able to do testing is a argument for having more competition. And Cole wants to be unmuted.
Yeah, I appreciate that. I'm just going to say we've got about 2 or 3 more minutes, and then I'll have to end our Zoom so we can all have a chance to have a quick break, because we have the required PD with social emotional learning that starts at noon. So Cole, if you have something quick, or else we can schedule another time to kind of go deeper with this topic. Matt, can you go ahead and unmute him?
Oh. Just trying to locate him in the in the list.
Yeah, and Mandy talked about Kate running in Florida. Wearing a mask up to the starting line, putting it on after the race, I think is totally appropriate. And we can just increase our ability to do that safely by doing antigen testing. And it wouldn't have to be just cross country. It could be any sport that we decided we wanted to do it with. And it doesn't require a medical person to do the testing. It requires somebody with either a high school education and a GED. It's run under the health department's CLIA waiver.
So all I just wanted to chime in with is that if testing our athletes gave us any kind of advantage for turnout or for competition, it would make a ton of sense to start doing that as soon as we could. But right now, being in phase 1, we don't have, there's really no benefit to testing our athletes unless it's to remove them from competition because of a positive test. So of course we want to do that, but I think to try and facilitate something like that right now, the costs far outweigh the benefits, in my opinion.
So I think as we move along this COVID journey that we've been on for too long, we'll definitely want to probably keep relooking at that and whatever we need to do. And just to appreciate, Dr. Larson, your time, and just appreciate the fact that we do have plentiful tests here, and that we've got that flexibility to put systems in place that are going to work best for our staff members as well as our students. So thank you, and I look forward to Zooming again at 1.
Okay, bye.